This is episode 46 of the BioBalance Health cast, and I am Dr. Kathy Maupin.
And I'm Brett Newcomb. And today we are talking about some issues that clients have contacted us about and said, please talk about these issues. And we're talking specifically about chronic fatigue and fibromyalgia. As an intro to that, I want to talk about the way your practice is distinct from other practices where people hear about hormone replacement therapy, because you want to make the case that hormone replacement therapies do impact the disorders of chronic fatigue and fibromyalgia and some others as well. But in order to make that case, I think first we need a little more information about why is your practice different from others?
I think my practice was built on the basis of listening to my patients and asking them what they wanted. They told me they wanted to pay for what they get. They didn't want to have a large thousands of dollars up front, like a retainer, like some of the practices have today that are doing bioidentical hormones. They also did not want to be in my office every month. And they're busy. And once they're better, they have a lot of catching up to do. So they only want to come in a few times a year. After we get them organized with a maintenance dose, the first couple visits are about getting all of the doses proper and all the dietary issues taken care of. And then after that, everybody just comes in 3 times a year to get their tank filled up. And it's bioidentical, estradiol, and testosterone. I'm not a fan of giving progesterone to men. I'm not a fan of giving progesterone if you don't have a uterus. I believe that those who say that you should have that haven't worked with progesterone their whole lives like I have. I just don't think it's necessary for everyone. But I have set up my practice so that it is patient friendly as much as a medical practice can be, with short waits, hopefully. Right. My nurse practitioners are the ones that do the insertions of the pellets after I figured out the dose.
Right.
They also have been working with me for 9 years, all of them, so all 3 of them. So these women are very astute at understanding hormones. In fact, they understand them much better than doctors.
So your practice is patient-friendly and cost-friendly.
Yes.
I mean, in reality, there are other practices that focus on hormone treatments as well. And your general obstetrics and gynecology practice was a traditional one for 25 years.
Yes.
You have now evolved into a specialty focus on the focus of HRT, hormone replacement therapy.
Right, with bioidentical hormones
only.
And
the
in
way
general
you set it up,
pellets.
so people come and see you, you interview them, find out what their needs are, determine a dosage, and then they don't have to come in every month, they don't have to see you every month, they come in once every 3 months. The cost factors for that are reduced for them, and that's good because it's not covered by insurance for women, as we talked about in our last podcast.
That's right.
So it's efficient for them, it's cost effective for them. The competition, as it were, requires an annual retainer and a monthly visit and a monthly set of lab tests.
And a monthly insertion,
And
where you get stuck every month, which I can't imagine.
Just put a zipper in or Velcro.
I know, really. I mean, it does kind of seem like that. Yeah. But our incisions are all healed. They're tiny, and I've actually retooled our instruments because women didn't like to have a scar, even if it was a tiny little scar on their hip. No scars. So I made the instruments very small, and because of that, that's different than elsewhere. I listen to my patients.
So specifically then about the topics that we've been asked about, can you talk a little bit about the distinction between, or the connection between fibromyalgia and chronic fatigue? What are those, and how are they different from one another? How are they connected to one another?
Many times they're confused in the world of diagnosis, and both of them create a great fatigue, a tiredness that is like bone tired, not like, oh, I'm tired because I stayed up all night, or or my hormones are just off. It's more tired than even hormones being absent cause. So this is the fibromyalgia, though, is an autoimmune disorder. Actually, that means that your own immune system has attacked a tissue in your body. Generally, both start with a virus, and that virus looks similar to your bones and joints.
And are they both painful?
And chronic fatigue is not physically painful.
Okay.
It's just emotionally and
But the
spiritually painful.
fibromyalgia
Is painful, and that's a difference.
Okay.
People with fibromyalgia have traveling pain. They have pain here one day and all over their body, 5 or 7 spots of pain every day. But the areas of pain change. So this is your own body attacking your muscles and nerves. And so in that way, it's different than chronic fatigue, which is a virus attacking you, and then you can't get over the virus. Your immune system has been compromised somehow, and generally it's compromised by loss of testosterone. So when your testosterone drops, your immune system doesn't work right. We talk about T cells with AIDS. Well, T cells drop with loss of testosterone as well, not like it with AIDS, but it is a drop of your immune system. So you can't kill viruses. So chronic fatigue is a chronic virus that just won't go away.
So testosterone is like the dam that holds back a lot of these things that are waiting to break down the system, like osteoporosis or dementia, Alzheimer's.
That's long term.
Yes.
That usually is happening later, and we can prevent those things by giving estrogen and testosterone during the first 10 years and thereafter.
Right.
So if we hit that sweet spot 10 years after andropause or testosterone deprivation, which is around 40, and 10 years for estradiol being given after menopause, then we can prevent most of these illnesses.
So the evolutionary structure was good until 40 to 50. And most people never lived that long. And so that was enough. But now that we are living longer, the time frame for that is so telescoped that the evolutionary structure has not changed.
Right. We're still the same human being physiology and anatomy. We're healthier, but as the caveman, we still have the same equipment, and it works the same way. So we were built for a shorter lifespan, but we're smart, and we've learned how to live longer, but we have not learned how to live better. This is how to live better.
Right, in part because the testosterone replacement, which is the bioidentical hormone tablet pellet that you insert, that protects the immune system. It restores those testosterone levels to what you had when you were 20 and 30, and that acts as a filter that holds back those destructive
It's what kept
changes.
us healthy in our youth. And everyone wants to have their youth back, at least most of us do. And that's because we were healthy. We didn't sit around and think about all of our bodily functions every day because we were well. You never think about illness when you're well. So we get to 40 and then all of a sudden symptoms everywhere, and there's no answer to it except the answer that I found for myself and for my patients, which is bioidentical testosterone pellets. Now, at menopause, we had estradiol, which is young women's estrogen. And so that then replaces that missing hormone. The whole idea is replace what's missing.
Right, which are natural substances that we naturally had and we naturally lost.
Right.
But now we're intervening to restore that.
That's absolutely correct. And we can do away with many meds. I mean, oftentimes people are concerned about the fact that it might cost $400 every 4 months, 3 times a year, so $1,200 a year. But we're able to get rid of copays and for all kinds of medicines because you don't have medicines for the symptoms of something you don't have anymore. So that's big, especially in something like chronic fatigue or fibromyalgia. There are many meds that are given just for pain in fibromyalgia and for energy and sleep in chronic fatigue. So those two things, we wipe out maybe 4 or 5 medicines, and that pays for the pellets. But
So you were saying that chronic fatigue is a result of a viral infection.
they're both from viral infections, but the virus does something different in each.
Okay, and so the infections from that cause the chronic fatigue impact negatively the immune system. They compromise the immune system.
They're actually unable to, the immune system, for you to get chronic fatigue, your immune system is already compromised. And therefore, for you, when you get that, that's usually because you've turned 40 or 38 or 50 and your testosterone dropped to a critical level. And then you can't fight that virus, so you can never really get completely over it. So it just lives in your body, and your body uses up all its energy trying to get rid of that virus, and it can't. So when I treat patients with testosterone, I have a about 50% cure rate, and then the other 50% are very difficult. We have to try all kinds of other things to actually get chronic fatigue to go away, and some of those are antivirals, because it's viruses that cause chronic fatigue.
So it's like a crack in the dam. Because your testosterone has dropped, then your body is available to be attacked by these parasitic viruses.
Your body's also available to make cancers. You just may not see it for years after that. It just doesn't have the immune system it needs
And so in about
to kill things off.
In about half of your patients that suffer from these issues, there is a cure.
Yeah, they're dramatically better.
The replacement of the testosterone seals the crack in the dam, and they are healthy, and the chronic fatigue goes away.
Because their immune system
Has
increases.
regenerated, has improved. And then for the other half, it's still helpful, but you have to add supplementary interventions.
Right.
Which are still less costly and less stressful than not treating it with the testosterone.
That's true. That's true. It's just very hard. It's a very hard illness for anyone to treat. And I have a better success rate there than other people do by using multiple drugs. Fibromyalgia, however, generally goes away when I treat with testosterone, and their fatigue goes away. That is something, all autoimmune diseases are much better. I love it, much better after testosterone.
Yes.
Rheumatoid arthritis, lupus, testosterone suppresses the autoimmune response.
The avoidance of eventual things like osteoporosis, dementia, Alzheimer's, there's an improvement there as well that you can document.
That's right. That's right. There are many studies that show the benefit of testosterone replacement in women and in men that show that their life after 70 is much more independent and productive and enjoyable, because you don't have to be in a walker, you have your muscles. You don't have to be in a wheelchair and dependent on other people, which I think most of us who are old enough to actually think about that or have taken care of our parents know that that's very
sandwich generation
upsetting
really
and we don't want our children to have to do that.
Yeah.
So to be healthy is to love your children and to prevent them from having to take care of you until you die. It may not give you one more day of life, I think it will, but it will give you a quality of life as long as you live, as long as you keep taking the hormones. And that's possible. I have an 87-year-old and 85-year-old who take these hormones.
That's incredible. So we have specifically focused this conversation today on questions and comments that we have received from patients. If you have questions or comments that you would like for us to address, you can get that information to us so that we can talk about it by contacting us at
BioBalanceHealth.com, and you can also call our office at 314-993-0963.
And you can read my blog at brettnewcomb.com. Thank you for listening.